Okay, deep breath. Hey everyone, it's Jessica with Montana Family Pharmacies, and I'm here with Pharmacist Josh again today, and today we are going to be talking about Seasonal Affective Disorder, or SAD. So this is the time of year that a lot of people seem to, especially in our area, seem to have symptoms of depression and different things like that. So what can you tell us about SAD?
So seasonal affective disorder is a form of depression. It's kind of characterized during the winter months is the most common. It's more tied to a specific season or time of year. We typically see it in the winter. It's related to the shorter days and less sun exposure. For a diagnosis, you typically have to have it for like recurring years for, this year and next year and the following year. You have to have at least 2 consecutive years for a diagnosis. The first thing I recommend is anybody who, if they feel that their mood is being affected by the weather or by the season, and if it's starting to be of concern, I do recommend that they see their physicians right away, just to make sure there's nothing else going on. Okay.
So what are some of the symptoms of SAD?
Some of the symptoms of SAD would be low mood, poor concentration, poor focus, poor sleep. Oftentimes our eating habits get bad. We do a lot of carb craving and kind of eating our emotions. Weight gain can be associated with it, which is then kind of causes more depressive feelings, so it kind of turns into a negative cycle there.
Right. So for sleep, they just like don't sleep well, or too much sleep, or it can vary?
It's typically not sleeping well, but sleeping a lot, or spending a lot of time in bed or on the couch laying down, but not necessarily getting good, what we call quality sleep.
Okay, so what are some ways that people can either prevent or treat seasonal affective disorder?
So important things to do to help prevent SAD or to help kind of treat it would be, first would be modify your diet. Eating more fruits, more vegetables, things like that, getting in proper amounts of, the nutrients that we would get from that kind of help offset some of the effects of SAD. Exercise is a great thing too. Really helps us emotionally, helps us physically, helps balance hormones. So I'm a big proponent of exercise, even, like we've talked before, it just doesn't have to be a lot, just enough to get up, be active, kind of break that cycle of SAD. Open your shades, try and get outside and enjoy what sunlight we do have. Sunlight is a big factor in this. So oftentimes with the shorter days and work schedules, we're just not getting sunlight, or the cold weather, we're not going outside. So probably one of the most effective treatments is what is called light therapy. So light therapy is where they use special type of light. It's kind of more designed to mimic natural light as far as in wavelength and strength, and it's filtered into a light box, if you will. Light therapy is probably the most effective treatment that they have for SAD. So light therapy is a very safe option for the treatment of SAD. Most common side effects with it would be maybe some eye strain from the extra light, maybe some headaches. Some people maybe get a little nauseous just again from the visual aspect of the light. If you have skin sensitivities or things like that, or if you're taking certain medications that can make you more sensitive to light, that may be something that you'd want to discuss with your physician before doing. Other than that, it's a very safe, very effective treatment. So it's important when you're starting light therapy that you kind of do your research and you get the right light box. There can be different strengths or different kind of powers, if you will, and that's going to determine how long that you need to do it. Obviously, the more potent that it is, or the more powerful that it is, the less time you need to spend in front of it. Typically, people do 20 to 30 minutes of light therapy a day. It's best done in the morning to kind of start your day off right and kind of get your mood going right away in the morning. So a lot of people are kind of wondering like if they can use tanning beds or things like that as a supplement. Tanning beds aren't effective and actually can be dangerous just because of the effects on the skin. The light boxes typically have filters to block out the UV rays that can be harmful to our skin. So much better to use a light box than try and get it artificially through a tanning bed.
Right. Okay.
Just a few pointers with light therapy. Want to be consistent. It's important to make sure that we're getting it done every day. Make sure that you've kind of done your research, you get the right light box, one that's going to be the right intensity for you, and one that's going to be safe. Make sure it's got a good filter to block out the UV rays. Also important to kind of like do a log of maybe when you started it, as far as started it in January or started it in November, and then how long you've done it, so that way you can kind of track your mood as well. And so as maybe spring starts to come and your mood's getting better, you can start doing less time and kind of keep a good log. Be important for the following years, and just a good way to kind of guide your treatment. And the other thing, just make sure that we kind of take a full approach to the SAD. Don't rely on just the one therapy, the light therapy. Make sure we're doing the other things too, the being active, the trying to eat right, trying to get healthy amounts of sleep,
Right.
not oversleep, because that sometimes can make things worse. So just trying to, maintain a consistent lifestyle as much as possible is going to help.
Okay, great. So, as we know, it's called seasonal affective disorder. So what is it about the change in seasons that affects our mood?
The biggest link that they make with that is exposure to sun, or the amount of time that the sun is out. So the sun plays a very important role in our body physiologically. So it's used to help regulate melatonin, which is used for sleep. Our body uses that to regulate sleep. And also the sun also is responsible for our serotonin levels as well, or affecting our serotonin levels, which is used to affect which serotonin has a big impact on our mood.
Okay.
So the sun's effects on melatonin and serotonin have a big impact on how it affects us for mood and sleep. Another very important thing with the sun is vitamin D. So
Right.
vitamin D is important for not only our mood, but also for our energy. Our body stores and uses vitamin D to keep our muscles, active and strong. In low vitamin D, we get a lot achy and sore, tired easily. So having good vitamin D levels is an important thing. Vitamin D supplementation is actually a good thing to add for SAD treatment as well.
Mm-hmm.
I recommend to everybody, especially in Montana, anybody in a northern latitude should be taking vitamin D daily. We just don't have enough sun exposure, and our UV index is so low that even if we could be outside all day, we still wouldn't absorb enough sunlight to generate the amount of vitamin D that our bodies need.
Okay. So if somebody is struggling with SAD and they do the light therapy and they've changed their diet and exercise and stuff like that, and they're still having some depression, what other options are there out there for them?
So definitely we want to make sure that they're following up with their physician. There's some prescriptions, medications that are very effective. Oftentimes the SSRIs, which are just your standard antidepressant, Prozac tends to be, or fluoxetine. Prozac or fluoxetine tends to be the most commonly prescribed and most effective medication for that. They can also use things such as like Wellbutrin or bupropion as a preventative medication, and there's a few other medications that we can try. There's actually lots of options out there that can be added to the light therapy and the diet and exercise to help treat the SAD. And one thing with the medications is oftentimes light therapy has been shown to be clinically as effective as medications.
Oh, interesting.
So light therapy is still the gold standard, but sometimes we do need to have something a little bit additional, and always best to have that evaluated from a physician.
Right. Okay. As usual, thanks to Josh for talking to us about another important topic today. If you have questions about how you're feeling, and if you feel like you may have seasonal affective disorder, definitely talk with your physician. And then you can see your local pharmacist for recommendations on light boxes, as well as obviously you can get some supplements and things there, your vitamin D and all of that. And find your local pharmacy at montanafamilypharmacies.com.